Retinal detachment. Visible light rays form images that reach the brain. In order to do that, the retina converts the light signal into a nerve impulse. Think of the retina as silky wallpaper that lines the inside of the eyeball. Unlike wallpaper, however, there is no glue. Some holes can develop in areas where the retina is exceptionally thin or damaged. If this happens, the clear liquid vitreous that fills the eye can seep behind the retina and cause the wallpaper to come off. This is retinal detachment. Although a detached retina is not painful, it is an urgent medical situation. If the retina is not reattached to the eye wall promptly, retinal cells starve and permanent blindness can result. Risk factors for retinal detachment include the moderate or extreme nearsightedness, previous eye surgery or injury, previous retinal detachment, inherited thinness of the retinal tissue.